Um, Before everything, I would want to ask how many of us are, let me say, um, yet to give birth. Please, can I have like two or three people? Then I'll know where I'll send my next question.
Please, the question again.
How many of us are yet to have babies, either a male or a female?
You want show by hands or
Yes, by hands, by hands. Okay. Then my next question is going to be if someone can share the joy when they had their first child, how was the feeling like? Can anybody share with us? Or we are all here to give birth?
It was amazing. It was a nice one.
It was amazing.
Yes, it was.
Did you have the opportunity to be at the labor ward?
Yes.
So when the baby was coming, how was the feeling like?
Oh, it was something out of the world, you know. It was an experience. I didn't know how to describe it, but it's an experience.
So you just gave me the answer I was looking for. I've had interaction with more than, let's say, 30 first timers, and all they told me was an experience they cannot share. So I was asking myself, what at all is the experience that you can't describe it? So that should tell you what goes around giving birth. Sometimes we are overwhelmed, sometimes we are overstressed. So once the baby comes out, you don't know where you find yourself. It's something people find it very difficult to explain. Like I'm saying, out of about 30 men, let me put it that way, 30 men I've spoken to, none of them was able to describe the right feeling. So the first timers, please keep this in mind. Probably when we meet another time, you'll be able to share the experience as all the people I've spoken to have not been able to share their experience with me. Okay, so let's zoom in.
So can I share my own?
Yes, please.
Okay, so I just gave birth about 5 weeks ago.
Okay, okay.
So yes.
Fresh
So
mother,
when
congratulations.
yeah, thank
Congratulations.
you. Thank you. So when the week came, actually it's like a burden has been lifted um at that moment. But nobody prepared me for the fact that after the baby had come, breast milk should follow. And
Okay,
the anxiety, the stress that comes with it. For me, the first day, it wasn't that easy. It didn't come actually, so I was discharged home. And I was told to come and get the BCG on Monday. So it was Thursday, then Monday. And then he was supposed to pass the meconium. And without enough breast milk, it will not come. 2 days has
yeah.
come and still the baby hasn't passed. And you see, like I was so tense, stressed, and I didn't know that the stress and tense also would affect the breast milk
Breast
production.
milk.
Yes. So it's a whole lot that we need to be prepared. Even it's not only about the labor, but after the labor, we have to be prepared because actually I'm a nurse, but I didn't think about the post labor. Let's say the what I was supposed to do, certain food I was supposed to even take, and a whole lot. And the baby was actually turning yellow. It was a whole stress for me. So mine is just that, and by God's grace, now everything is fine. Yes. Hello.
We can hear you.
Yes, please, I'm done.
Hello, Doc.
Hello, I can hear it. No.
Can you hear me?
Yes, we can.
Okay, sorry about that. So, as I'm saying, I think it's something we need to look at it holistically. Antenatal is supposed to prepare you through pregnancy till you give birth. And then 5 years after giving birth, you should be equipped with how you are going to take care of your child. But it seems you are not giving parents that much. So over here in Pantine, we've taken it upon ourselves to organize pregnancy school and then post-delivery school, whereby all these expectation anxieties are being handled. Because we find ourselves in the psychiatric institution, we see a lot of this condition, postpartum psychosis. So we've taken it upon ourselves to tackle it head on. So let's zoom in into our presentation. So we are going to look at the definition, the incidents, causes, signs and symptoms, effect on mother and baby, when to seek help, treatment or management, prevention, and then what we are supposed to take home at the end of the presentation. Please, can you hear me?
Yes, Mr. Nate,
Yes,
can be heard.
Okay. All right. So we are
You can be
saying,
heard, please.
okay. So we are saying postpartum depression is a type of depression affecting most women after having baby, which interferes with her activities of daily living as well as caring for the baby. So someone will ask, what are activities of daily living? So as a woman, you know, when you wake up, you need to keep the house, you need to make sure there is food. If there is cleaning of the house, you have to do. If there is shopping, you have to do. If there are other events you need to attend, you attend to them. But mostly after giving birth, the woman wouldn't want to do any of the things that have been said. So we are saying that it usually occurs 2 to 8 weeks after delivery, but can occur a year after the baby is born. We need to know this very well. So 2 weeks to 8 weeks before we can diagnose someone as having postpartum depression. So if the duration is less than 2 weeks, we can say that that person is going through stress. But if it lasts more than 2 weeks, then we can say the person is going through the depression. So there's what we call postpartum blues. Mostly feeling of depression and anxiety are common after delivery, which last up to 2 weeks, largely due to the changes in hormones. Mostly, we've also found out that that is not the only cause of the postpartum blues. There are other causes, let me say, risk factors or predisposing factors that can let the woman experience postpartum blues. So let's look at the incidence rate in Ghana. Actually, this was one of the studies done by a psychiatric resident at Pantine. So in Ghana, we are saying that the prevalence rate varies across studies, with some studies pegging it at 16.8%. It is a common problem affecting more than 1 in every 10 women within a year of giving birth.
Hello, Mr. Nate. Sorry.
Yeah.
Please, can you share your screen with us?
Okay.
All right. Thank you.
Please, can you see the screen now?
Yes, please. Thank you.
Okay. So we are saying that it's not only the mothers that are affected, the fathers are also affected. So I will explain why the fathers are also affected along the line. So causes of postpartum depression. Ideally, there is still research going on to find the exact cause, but these are some of the factors that mostly will predispose the women to postpartum depression. We have the hormonal changes, rapid drops in estrogen and then progesterone after delivery, mostly because of the production of milk. Prolactin hormones take over. So these two hormones are normally kind of suppressed. So once the prolactin levels are high, these hormones are kind of suppressed. And these hormones basically takes care of our flight and fight. So once they are down, it tends to affect our mood. We have stress. The stress that comes with new parenthood. Baby will be crying every now and then. You are not getting enough sleep. Then changes in family roles. Probably you are the breadwinner. Now there is baby. You can't go to work. Finances would some way or somehow be affected. It can go a long way to trigger postpartum depression. And then relationship issues. After giving birth, there is still challenge. Oyameba, enyoba, eyoba, enyameba. Those stresses also can lead to that because there are some women that will go like, after I've gone through all this pain, he's telling me the child is not his. The next moment you realize this woman will be suffering from postpartum depression. And then there is prior history of depression or mental illness. So it's believed that once the lady has that tendency or has experienced depression in the past, the possibility of getting this postpartum depression is very high. And then social and environmental factors. When there is lack of social support, financial difficulties, as I said earlier on. So, what are the signs that will let you know someone is going through this postpartum depression? So, we are going to put it in 4 categories. So, we'll look at the emotional symptoms. So, you visit this mother at home, instead of you expecting to see the mother being cheerful, playing with the child, that is not the issue. You see extreme sadness on the face of the mother. And then at certain times, they are very anxious. Every minute, you see them either going out to check if someone is coming or not. And then there's hopelessness. The hopelessness, mostly when they are talking to you, you could pick the cues from what they tell you. And then there are times you visited her, you are trying to engage in conversation, but it seems whatever you are saying doesn't sit well with them. They're listening, they are irritable, and they can stay a whole day even without touching the baby. And you know, around that time, the touch from mothers help babies to bond, vice versa. But in situations like that, barely would you see them even playing with these babies. And then mood swings. There are some of them at one point they are happy, at another time they are not. You go there in the morning, you see mother playing with child. Go back somewhere in the afternoon, mother is not by baby, isolated, alone, crying sometimes. The other times, they might even leave the house and leave the baby alone. When we look at the physical bit, there is change in sleep and appetite. And then they easily feel tired. They don't have the energy to do anything. So it's been established that Because of these physical changes, there are some of them that end up developing other medical conditions. So in times where they are not eating, they end up getting peptic ulcer, they end up getting hypoglycemia, so many medical conditions. So in times like that, we don't only look at the physical aspect, the psychological aspect of their management. We also look at the physical bit if there are any other underlying conditions. Then with the cognitive aspect, there is difficulty in concentrating. When you are engaging them in conversation, you realize that whatever you are discussing, they don't focus much. You ask them what you are saying, and then the next minute they are lost. Making decisions becomes a challenge for them. They are not able to think clearly. You might be asking them simple things that they do every single day. They are not able to tell you. Sometimes even what they've eaten, they are not able to tell you. Whether they've bathed their child or not, they are not able to tell you because they are not thinking straight. With their behavior, mostly you see them withdrawing from social activity. So if this is someone who in the past would want to engage on social media, now they are off social media. If they are someone who mostly will come visiting friends with their baby, all of a sudden they've stopped doing that. Church activities, no more. Even people they live with in the house, they wouldn't want to engage them. They neglect themselves. You go and they look very unkept. Their hair, their clothing, even the smell that greets you when you get to them can tell you there's something going on. And in real time, mostly you hear them say, I wish this baby is dead. So once you go to them and you're engaging them and you realize they are making such comments, then you need to be worried. There are times when you get to such mothers, the way they even position the children, the babies should tell you. Sometimes you have the pillows on their head, you have them cover them entirely with cloth, suffocating them. So once you visit a mother like that, these are some of the things you should be looking out for. So effect of postpartum depression on the mother. So with the mother, mostly there's poor bonding and then care of the baby. When you go, you're expecting the mother to be bathing this baby in the morning. You go as at even 11 a.m., baby might not have taken the bath. The place baby is kept, you could see is not well arranged. Towels, everything, anywhere scattered in the room. When this start happening, either husband or relative should be worried. And then if at the initial stages, this depression is not well taken care of, it leads to long-term depression. There is difficulty with breastfeeding and then changes in maternal behavior. This is someone who was so lovely, who was so cheerful. But now, the least thing you do, they get angry. The least thing you say to them, there is fight. The least thing you say, they go destroying things. And then mostly it ends up in suicidal ideation or infanticide ideation, whereby you hear in our news that mother and child drank poison and then both of them are gone. So if this is not handled well, these are some of the things that can happen to the mother. And then with the baby, uh, mostly there are emotional and behavioral problems. So you go to some places, you see some kids, they behave very differently because probably at that early ages, they didn't get that kind of bond, the love that they needed from their mother. So every now and then, they look off from all the other kids. And then when it happens that way, these kids grow up and they find it difficult to bond with other people because they are not getting enough breast milk during these phases of development, they end up having cognitive and then developmental delays. Their age per their physical body mostly don't correlate. You see him 5 years, but he's looking like a 2-year-old. And then there's higher risks of certain health disorders. Like I mentioned earlier on, because they were not eating, they neglected themselves, they end up having other medical conditions like peptic ulcer, hyperglycemia, hypoglycemia. So many medical conditions can arrive out of this. In instances whereby they even pick physical injuries, there are defects, deformities, and all that. Then there's social skill impairment. Since the child didn't get that bond, um, growing up becomes a challenge because you live in a place where the basic things that were supposed to be impacted onto you right from birth, you are not getting them. Even how we play with the kids, how we play with the babies at that early stage makes them grow as cheerful kids along the line. So once these things are not catered for at the early stages, it goes a long way to affect them when growing up. So, like we said earlier, there's suicidal ideations. So it could also lead to mother killing the baby. So when to seek help? If symptoms persist for more than 2 weeks, please, we need to seek help. And then, fortunately for us, the ministry have made it possible for us to have community wings all over the country. Once you enter into a district facility, definitely you are going to see a mental health nurse or a mental health practitioner who can come to your aid, do the necessary assessment, and then you will be saved. If persons, if symptoms interfere with daily activity or caring for the baby, so once you realize it's late in the morning, baby has not been fed, baby will be crying all night, and it seems nobody is caring for baby. And you go in the morning, observe, and you realize mother is not breastfeeding baby, then it should tell you something is going on. You need to seek help. If they are thought of harming oneself or the baby, so once you engage mother and mother starts saying, "Me cry my bread, akwaraa kura onye me ba, me nya me kunu, eku me ho kura ka ho." Once you start hearing comments like that, then you need to know we are not doing very well. Quickly, we have to seek for help. So, for treatment of postpartum depression, we've categorized it into four broad headings. So, we look at the psychotherapy. So, psychotherapy is mostly given by professionals. So, some of the nurses, doctors are trained to give this form of psychotherapy. But on the large, mostly is our clinical psychologists who have been doing most of this psychotherapy, whereby they engage the mothers in talk therapy and then try to find the underlying issues and develop coping strategies. And when psychotherapy fails, then we have to look at medications. Mostly we put them on antidepressant. So once I'm saying antidepressant, don't go to the pharmacy and tell them I want antidepressant. There are so many antidepressants. And before we put someone on antidepressants, there are factors that we consider. The age, the severity of the condition. We look at the positive signs, the negative signs. There are so many things that comes into mind if we have to put someone on the antipsychotics. So there are support groups. Now there are a lot of support groups going on. Mother to Child Foundation, you hear a lot of them. So we've encouraged, uh, let me say, multiple multi-parents, that is women that have given birth more than once. We've given them that opportunity to form groups so that they can help the first timers deal with situations like this. lifestyle changes. So we encourage that after giving birth, these mothers should get enough sleep, they eat healthy diet, exercise regularly, and then practice relaxation techniques. These mostly are taught by health professionals. So there are times you'd want to go to online and see some of these things, but mostly there are twists to some of these therapies that we do. It's not a straight jacket. You assess the patient before you administer the therapy. So how are we able to prevent this from happening? We are saying that if you want to prevent it, then you need to assess early screening and intervention by professionals, positive parenting and bonding. We need to seek support when needed. Now, our world is becoming something else. In the past, when you give birth, you are living in a compound house. You have so many people to help you take care of your baby. But now you're alone with your baby. I once told a colleague that the kind of world that we are moving with, when you give birth, even using the washroom becomes a luxury. And she was asking why. I told her, yes, you'll be in the washroom, the next minute you hear your baby crying. Would you want to leave or continue with what you are doing? And the rest was history. She was crying and she didn't know whether to get up or go for baby. She had to end it and go for the baby. So when I think 3 days later, she called and told me, look, today I've experienced the worst thing ever. You told me this and I didn't believe it. And today I have kind of seen it. So once we give birth, we need to reach out to people. Once we need the support, seek for it. Don't feel too shy or feel like I'm a superwoman. I can do everything by myself. No, you are not a superwoman. You need to seek that support. And then setting realistic expectation before and after the delivery. This is where it creates a lot of problem. After delivery, I don't want my child to cry much. So I have to put this system in place. Some of the children are born natural criers. Whatever you do, they are going to cry. So if you set that expectation for yourself, and this child comes and is kind of crying every minute, then it becomes so stressful. And if it's not handled well, it leads to some of these breakdowns. Prioritizing self care, most especially rest. So, in our side of the world now, we don't have a lot of support. In the past, you could leave your baby with your mother and have a nap. Your mother will do everything that the baby needs. But now, our mothers are also working. So, you wake up in the morning and you work till you go to bed. So, sometimes you even forget yourself. Someone can wake up in the morning, bath the baby, prepare food, wash, clean the house. And before you realize, even breakfast, you might not have taken breakfast. So it goes a long way to have that self care. Either than that, it becomes a challenge because if you don't have good health, how do you take care of your baby? And then providing social support and involvement of the partner. When it happens this way, most of the men, we want to push you to your mother so that we can have our night sleep. We can enjoy our outings. We can enjoy everything that we have to, forgetting that it takes two to tango. The two of us went in secretly. Someone has carried the whole thing for 9 months. After giving birth, instead of giving a helping hand, you say, oh, come on, mijo. So if you're not really ready to go through this, then please don't even venture. Because as first timers, it really gets to us, especially when you have to wake up early and go to work, and then baby is crying all night. You wake up, you don't have enough night sleep. This is where the men are also affected. You wake up, you don't have a night's sleep. You go to work, there's pressure at work. There are goals you need to meet. So the brain hasn't rested. And then you move straight into the pressure. You go through the pressure the whole time, and then you come back home. Once you get back home, oh, da, unjene kakra na minye way. Oh, me de jami, ejuma bebre, or sime. So once you start doing that, then you start creating tension and conflict in the house. So you need to program yourself very well when it gets to this stage, the men especially. That is why now we are even fighting that paternity leave should be moved to at least 10 days because the initial 10 days is very crucial. Role changes. Instead of probably mother going to the kitchen to prepare food for everybody, now you, the man, you have to go to the kitchen to prepare the food. There are times you have to take care of laundry and all that. So sometimes when these role changes are not well handled, then some men end up having depression. So we are fighting that. If you know your office won't give you that paternity leave of 10 days, already you know expected date of delivery. So you can push your leave around that time so that you don't have to deal with work pressure and then the coming of the new baby. So this is something we're encouraging the first timers to pay critical attention to because it's very overwhelming, especially if you don't have that external support and you have to take the mother role. It becomes very challenging. Stress management. So stress management, it comes in various forms. Even managing your time well to have sleep is stress management. Finances, you need to look at it holistically. Once you're able to look at it holistically, I think you have that safe mind. And then practicing a healthy lifestyle. So someone who asks, what is the healthy lifestyle? The healthy lifestyle is eating well, having enough sleep, knowing when to take break, and then the ultimate, managing of the stress very well. So our take home today is postpartum depression is a serious condition affecting many new mothers. Early detection and treatment are crucial for both the mother and the baby. It is important to recognize the symptoms early and seek for help at the hospital. It is our responsibility as nurses or healthcare providers to provide the needed care to affected mothers, babies, and even fathers in such situations for the needed recovery. Thank you.
Thank you very much, Mr. Nati. That was a great presentation. So please, if you have any question, contribution, you can just unmute yourself and then you talk, please.
Hi.
If you can't talk, you can also write in the chat box as well.
Can you hear me? Hello?
Yes, we can.
Oh, hi. Dr. Emma, this was a very good presentation. I think particularly obviously, I haven't, just a caveat, I haven't given birth yet, but for me, it's important to attend sessions like this because it helps we the men to better prepare, especially getting close to delivery and planning ahead and supporting the spouse as much as possible. I think as you sort of alluded to within your presentation, The world is changing a lot, and a lot of support that our wives or girlfriends or partners used to have is no longer there because everyone is striving for better opportunities. So that's family support whereby your mother, your auntie, your sister, or whoever is in the house can take care of or help take care of your child is no longer there. So preparing ahead of time, planning, especially the men, how best we can support women would hopefully help in terms of reducing, the stress and the burdens on the women, and this can be shared between the two partners so that not one person is overwhelmed. So that's my little contribution, but the presentation was fantastic.
Thank you. So you said something and it caught my mind. So probably let me share briefly how mine was, and then it might go a long way to help. So my wife is a nurse. I'm a physician assistant. We are all expected to go to work in the morning, do an 8-hour shift, and come back home. I work at Fantan Hospital. She works at Accra Psych. So latest by 5 a.m., she needs to leave the house and leave the baby with me. That was when she started work, I think 4 months after her maternity leave. So I have to be with baby right from 5 months. She goes to work. She comes back. Then I also have to leave to work. When she leaves to work, baby won't sleep for me to sleep. I have to carry baby throughout the time, sometimes 3 hours, 4 hours before she'll get back. And the funny side was, if it's about 30 minutes for the mother to get home, that's when baby will sleep. And by then, I also have to get ready, going to work. So I get to work very tired. So what can I do? I had to liaise with a few friends in between my 8-hour shift. I'll always get there late because she'll get here around 3 p.m. So I came to an agreement with them. I'll come late, but I'll release you to go home an hour earlier. And it really helped. So anytime she comes back, I can at least get an hour rest before going to work. At the initial stages, it was tough because I mostly get to work and I'm very tired because I had to do babysitting. But after I did that flexible arrangement with colleagues, it made life so easier for me. So as fathers, we are also affected. But you need to talk to your superior and see how flexible your working schedule could be made for you to survive. Because honestly, it's hectic. It drains you more than you can think of. Please, the floor is open.
All right. Thank you, boss, for your words so sweet. I think postpartum psychosis or anything about motherhood should such education should start from adolescent stage. Reason being that, as you said earlier, role changes, work, finances, everything is affected when we are expecting a new baby. So I think that if such education start from the adolescent stage, the girl child, the boy child is aware of the physical changes that may come, because some people get the psychosis because of changes in their personal appearance.
Growth.
Yes. So if they get to know this is what you are to expect when you get pregnant, this is what you go through. These are the changes. This is the changes being physical, psychological, financial. These are the things that you are going to go through. Even at birth, you don't expect that you put it to birth and then the very first day you are getting breast milk. And as our sister said, that one alone can make you anxious for several weeks. I've experienced it. My wife was not getting breast milk, but I was able to calm her down and hey, relax, it will come. People were even recommending some treatment. I said, don't worry, it will come naturally. So if such education goes on, then it comes back to healthcare professionals in our antenatal. Always we give health education to expectant mothers, but some of these key things we do forget to inform them. I wouldn't say it's intentional, but sometimes we have a lot of things to do at ANC, so we do forget some such petty things. And we have to encourage our wives. They have to take the supplement that they are being given. Some of them are going to help them to balance their emotions and all those things. However, sometimes people put pressure on themselves because they say, oh, for me, I cannot buy this brand. I cannot buy this brand. We just have to educate them that the normal folic acid and that red, yellow, green that we are being given at our antenatal is best. It has even more vitamin values more than some of the brands that they are pushing for. So I think the education should continue going on until we get to the last person, and then we will begin to reduce the 16%. That's my input. Thank you very much.
Thank you so much, boss. So you made a very important point. I asked about whether we were with anybody was with their spouse whilst giving birth at the labor ward. I asked this because during the firstborn, there was delayed, let me say, second stage. At a point, she said she was tired. And by then, unfortunately, when I was going, I left my identification card. So I was not allowed in. So later, I saw one colleague and told their colleague, this is what is going on. So you should just help me in. And when I went in, after speaking to her calmly, after seeing me, staying with her about 15 minutes, progression started again. So support is very key when it gets to this situation. You might be away making the millions for the family, but your presence also counts a lot, especially with the men. Sometimes the soft touch, the soft words we speak into their ears, it goes a long way to motivate them. So I'll plead the first fathers, if the EDD is due, kindly find a way. If you have to take your leave, try and take your leave. Because honestly, your presence counts a lot. With this modern trend where we are practicing the nuclear family instead of the extended family system. So let's make our presence felt throughout the whole journey. And we shouldn't even leave the postnatal clinics alone for the mothers. We should be able to go with them. The weigh-ins, it goes a long way to help. And now, most of the mothers are being given priorities once their husband accompanies them. So you're not going to spend much time giving them the needed support even after birth. Thank you.
Thank you. Please, any more questions? If you can't speak, you can just write in the comment section and then I'll read it out for Mr. Nati, please.
Hello, a contribution.
Okay.
Okay, so with the expected date of delivery. Sometimes you take your scan and then it will change.
Yeah, it
Uh,
is plus 2 weeks or minus 2 weeks.
it's not always true. I had an experience. Mine was
No, Gabby, you're muted.
I think her network.
I think she wanted to talk about the postpartum, sorry, the EDDs. Sometimes
EDD.
that varies.
Yes.
Yeah. You know, as she said, sometimes people may go beyond the 40 weeks,
Yeah.
even with education, or maybe let's try CS and others, some people may decline. But one thing is, as we are talking about education, attending ANCs, they will hear about certain things, and then, as our brother said, the support, somebody to encourage them, to motivate them, to let them know that such things may happen, though it's not always the same that you go beyond that, but certain things may happen. So when it happens, they just have to be frequent at the ANCs, take scans for the doctors to see that the child is healthy, mother is healthy, and then there are no issues. So when mothers don't get such education, when they don't get those supports, even someone to tell them that, oh, you can still go to the ANC, the nurse or midwife will examine you, will take a scan to see that the fluids around the child is okay, everything is fine. Then it brings that anxiety. It brings that anxiety, and then they begin to think, am I going to die? Am I going to do this? Some people are even afraid to hear the word CS. They are afraid. Hey, they said they are going to cut me. That one alone brings some fear. So it just comes back to support. Nurses, midwives giving the support, family giving those supports, and then all those things will end for us. Thank you.
Thank you. Please, any more questions? Hello. So I think we've exhausted all the questions, and then it's 8. It's not almost 8. It's 8. So we would want to thank Mr. Nati for this great presentation and then enlightening us on postpartum psychosis. And I know whatever we've learned here, we'll pass it to our sisters, our mothers out there, so that it will go a long way to help each and every one of us after delivery. So we started with prayer. So I'll call on Dr. Dave to end the meeting for us. And then we thank all of you for joining iMental March edition. Next month, we'll communicate our time, and then the next topic will be talking on. So, Dr. Dave, can you please give us the closing prayer?
All right, thank you so much. First of all, we want to thank our facilitator for this part 4 tutorials or presentations. We are much grateful, and it will go a long way to save our parents and our sisters and we ourselves when we get to that stage. God bless you so much. Please, let's pray. Heavenly Father, we thank you this evening. We adore you. We thank you for the life of our along the journey to us.
Thank you very much. God bless you all. Thank you so, so much for joining. Bye-bye.
Bye.